respond as follows, Honorable Speaker and members. I want to confirm that the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have been actively addressing cases of medical fraud within the healthcare sector. Through joint efforts and investigations, several facilities have been identified and subsequently suspended for engaging in fraudulent activities that compromise patient care and violate ethical standards. I would like to note that authorities have indeed taken steps to investigate and address instances of medical insurance fraud. Efforts have been made to scrutinize the practices of healthcare facilities, assess providers currently suspended by the National Hospital Insurance Fund Board. I have annexed the list on my response. As we collectively strive to uphold the integrity of the healthcare system and protect the welfare of patients and insurance beneficiaries, I encourage continued collaboration among stakeholders, effective enforcement of regulations, and clear communication to promote trust and accountability in healthcare delivery. Question 3, what measures has the government put in place to ensure accountability by healthcare facilities and to provide compensation to the victims of medical insurance fraud? Speaker and honorable members, the government of Kenya has implemented and is working on various measures to enhance accountability and combat medical fraud within healthcare facilities. Some of the efforts that the government has put in place is health facility census, and this we did last year in August. The government conducted a comprehensive census of health facilities to create a database that facilitates the monitoring and regulation of healthcare services. This initiative aims to identify and verify facilities to ensure compliance with standards and detect any unauthorized fraudulent practices. The second step or measure that we have taken is repealing of the National Health Insurance Act of 1998. The decision to repeal the Act and the enactment of the Social Health Insurance Act 2023 is a strategic move by the government to strengthen regulatory frameworks and enhance oversight mechanisms within the healthcare sector. By enhancing the Social Health Insurance Act, the government will introduce updated provisions that safeguard against fraudulent activities, improve transparency, and enforce accountability measures for healthcare facilities and providers. Honorable Speaker and members, I would like for the effort that they put in. Honorable Speaker and members, we have also we are in the process of procurement of a smart digital system. The government is in the process of acquiring a smart digital system designed to combat fraud activities. This signifies a proactive approach to addressing malpractices in healthcare delivery. The sophisticated digital system will streamline data management, facilitate real-time monitoring of healthcare transactions, and employ advanced analytics to detect anomalies or irregularities that may indicate fraudulent behavior. The system will be integrated with approved clinical guidelines to ensure patient management is standardized. Fourth is enhanced monitoring and enforcement. The government has intensified efforts to monitor healthcare facilities and enforce compliance with regulations. Enhancement of oversight through frequent inspections, audits, and performance of evaluations is going to enable regulatory bodies and the Social Health Authority to hold facilities accountable for adherence to ethical standards, quality care, financial, and transparency, thereby reducing the likelihood of fraudulent activities. Fifth, creating public awareness and reporting mechanism. The government is also focused on raising public awareness about medical fraud and encouraging individuals to report in healthcare facilities. The government will empower the public to play an active role, may provide more detail if there have been compensations of victims of medical insurance fraud. Honorable Speaker and members, I submit. Thank you.
Thank you, Honorable CS. Professor Jenda, do you have any supplementary question? You have an opportunity to ask it too, but if you don't have, you are satisfied. Good enough.
Honorable Speaker, I think given the response to the questions that are satisfactory, I'm satisfied with the responses. The only follow-up question, Mr. Speaker, sir, would be for the CS to explain to the House the intended processes that underline the implementation of the Social Health Insurance Act, and whether the frameworks, everything has been put into place to ensure that the repeal of the NHIF Act 1998 will not affect Kenyan population. Let me put it that way. Will not affect those who are beneficiaries of the framework of the processes under the Act.
Honorable CS, you can answer that one.
Thank you, Speaker and honorable members. Yes, indeed, the ministry has a process for implementing the Social Health Insurance Act. And for our starters, the ministry did gazette a transitional committee that has experts to ensure seamless transition from NHIF to Social Health Authority. The committee has been sitting for the last 3 months. It has developed a roadmap on what needs to be done in terms of implementation. Additionally, the ministry worked on regulations for operationalizing the Social Health Insurance Act. And indeed, the regulations were already approved and gazetted. So we are in the process of finalizing with the transitional committee to ensure that all matters are taken care of. And I want to assure the House that one thing that the transitional committee is ensuring is that the Kenyan should not actually notice that there has been a change from NHIF to social health them after every 2 weeks, so that I get appraised of the process. And our intention and our
not touching on the strike, so that I will give the CS opportunity to operate the Senate and the country. So if you have a different angle, then I can give Senator Mutembei.
Is related to the repeal of the NHIF Act. You have explained the good intentions and the plans you have in place to have a smooth transition to the new system. I wanted to ask whether you are aware that many Kenyans are still paying NHIF but not receiving services. We have many Kenyans whose NHIF cards are not being honored in many hospitals and they are actually stranded. Are you aware of that, and what are you doing about that?
Honorable CS.
Thank you, Honorable Speaker and Senator, of Exchequer release to NHIF. But I want to confirm that NHIF and together with the ministry, we have been having engagements with most of the facilities which are around the faith-based facilities. We've had a meeting with them. The rural health providers, we have had a meeting with them. The private providers, we have had a meeting with them and given a commitment that they should continue to provide services because the claims will be honored. Speaker and honorable members, I would like to inform the House that it is really natural that most of the facilities, due to the transition, then they would be a little bit not sure whether their claims are going to be paid or not. And some are taking that drastic action of not providing services. But as a ministry, we are continuing to engage them. And as I said earlier, one of the things that the transitional committee is doing is to verify the claims, to verify the assets and liabilities of NHIF. So, Speaker and honorable members, I want to assure facilities that there is no cause of alarm. They do not need to disrupt facilities. That once they have provided services, their claims have been verified and reconciled, they are going to be paid once resources are available. I submit, Speaker and honorable members.
Thank you. Senator Chute Mohamed.
Thank you very much. Mine is not something like a question, but I wanted to express my gratitude towards the CS, and I want to take this opportunity to thank the CS and the team, specifically the Director General, on this year. The organization intends.
Senator Chute, what is your question?
Yeah, I
can hear you are leading a statement. Appreciate the ministry.
Yes, I'm trying to.
What is your question?
I want the people of Kenya to know that we appreciate what the CS is doing and this organization also.
No, ask you a question.
Excuse me. Can you protect me from this guy? The speaker is asking.
All the members.
So,
all the members.
And Mr. Speaker, this is
have an opportunity to us to do that statement even later. It's kind of because of time. Just ask the question and then.
As I finish, I want Kenyans to know that what the Cabinet Secretary and our team are doing, and this is very important for me and most of the Kenyans. And also, Honorable Speaker, I hope and believe that the CS is capable of solving the dispute between the doctors and her ministry. And thank you very much, Honorable Speaker. As I understand.
I give you some good guidance, and now you are still diverting from my advice. So let us. There was no question at all. So let us have Senator Nyonka, Richard.
Somebody I've known in my previous life, and I'm happy to see her here. The question, Madam CS, that I'm asking you is this. The NHIF Act has been repealed. You have several health facilities and health centers all over the country. Some of them who have not been paid for the last 5 years, some of them have not been paid for the last 3 or whatever number of years. And what many of these Kenyans are asking is whether you have done an audit, and this audit is meant to give you the list of the outfits or health facilities or companies that have been providing these health services to our people. And if so, is it possible for you, for the simple purpose of accountability and transparency, to give the list within the regions where these companies come from, so that by the time you are transitioning to the Social Health Authority and you are transitioning with the healthcare fund, my suggestion, Mr. Speaker, is that this would make it easy for these Kenyans, many of them who are complaining and saying how they've never been paid and their things are being taken by auctioneers, and many of them have actually been disenfranchised. I hope the CS will be able to look at it and give us an answer on that.
Okay, let me get 2 more, then the CS can respond. What is your point of order, Senator for Kiambu County, Karungo?
Mr. Speaker, thank you for the opportunity. I am raising on a point of order 51C, 6C, that you had indicated that you might give the CS permission to give a statement on whatever is going. Some of us, we do have questions to ask that. So my question is, seeking your indulgence, you probably give the CS this particular moment to give a statement. Probably the questions that we want to ask are in that statement.
I give a very clear guidance to Senator Karungo Dango that I wanted to give a few senators to ask supplementary questions on the subject matter on this question. And then I'll give the CS an opportunity still now to make a statement. I don't know whether you are the one who is in a hurry or the CS or myself, and I'm not.
Honorable Speaker would have sorted, including Isiolo's process. We would like to know, in the transition period process, what is the department doing to make sure that the payments are being made, and what is the ministry serve as a mother ministry doing to pay the debts they owe to the defunct NHIF, including State Department of Public Service, for wiper amounting to millions of money, to make sure that those debts are paid before the new process begins. Thank you, Honorable Speaker.
Yeah, Madam.
Before the new process begins. Thank you, Honorable Speaker.
Yeah, Madam says that.
Repealing of NHIF Act. I think it is now clear that we are in the transition phase, and years, and even others that are longer than the 5 years. What healthcare system. Consequently, the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have taken action to address these issues, including suspending facilities found guilty of engaging in fraudulent practices. Currently, the prevalence of medical fraud, as per external actual analysis, stands at 20%. It is important for stakeholders, including insurance providers, regulatory bodies, investigating bodies, and law enforcement agencies to collaborate and identify, investigating and prosecuting individuals and facilities involved in insurance fraud. By enforcing strict regulations, conducting thorough audits, and promoting transparency and accountability in healthcare delivery, we can collectively work towards combating fraudulent activities and safeguarding the interests of patients and insurance beneficiaries. The second question, has the government conducted an inquiry into this matter? And if so, could the Cabinet Secretary table the report of its findings? I wish to respond as follows, Honourable Speaker and members. I want to confirm that the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have been actively addressing cases of medical fraud within the healthcare sector. Through joint efforts and investigations, several facilities have been identified and subsequently suspended for engaging in fraudulent activities that compromise patient care and violate ethical standards. I would like to note that authorities have indeed taken steps to investigate and address instances of medical insurance fraud. Efforts have been made to scrutinize the practices of healthcare facilities, assess providers currently suspended by the National Hospital Insurance Fund Board. I have annexed the list on my response. As we collectively strive to uphold the integrity of the healthcare system and protect the welfare of patients and insurance beneficiaries, I encourage continued collaboration among stakeholders, effective enforcement of regulations, and clear communication to promote trust and accountability in healthcare delivery. Question 3. What measures has the government put in place to ensure accountability by healthcare facilities and to provide compensation to the victims of medical insurance fraud? Speaker and honourable members, the government of Kenya has implemented and is working on various measures to enhance accountability and combat medical fraud within healthcare facilities. Some of the efforts that the government has put in place is health facility census, and this we did last year in August. The government conducted a comprehensive census of health facilities to create a database that facilitates the monitoring and regulation of healthcare services. This initiative aims to identify and verify facilities to ensure compliance with standards and detect any unauthorized fraudulent practices. The second step or measure that we have taken is repealing of the National Health Insurance Act of 1998. The decision to repeal the Act and the enactment of the Social Health Insurance Act 2023 is a strategic move by the government to strengthen regulatory frameworks and enhance oversight mechanisms within the healthcare sector. By enhancing the Social Health Insurance Act, the government will introduce updated provisions that safeguard against fraudulent activities, improve transparency, and enforce accountability measures for healthcare facilities and providers. Honourable Speaker and members, I would like for the effort that they put in. Honourable Speaker and members, we have also we are in the process of procurement of a smart digital system. The government is in the process of acquiring a smart digital system designed to combat fraud activities. This signifies a proactive approach to addressing malpractices in healthcare delivery. The sophisticated digital system will streamline data management, facilitate real-time monitoring of healthcare transactions, and deploy advanced analytics to detect anomalies or irregularities that may indicate fraudulent behavior. The system will be integrated with approved clinical guidelines to ensure patient management is standardized. Fourth is enhanced monitoring and enforcement. The government has intensified efforts to monitor healthcare facilities and enforce compliance with regulations. Enhancement of oversight through frequent inspections, audits, and performance of evaluations is going to enable regulatory bodies and the Social Health Authority to hold facilities accountable for adherence to ethical standards, quality care, financial, and transparency, thereby reducing the likelihood of fraudulent activities. Fifth, creating public awareness and reporting mechanism. The government is also focused on raising public awareness about medical fraud and encouraging individuals to report in healthcare facilities. The government will empower the public to play an active role. It may provide more detail if there have been compensations of victims of medical insurance fraud. Honourable Speaker and members, I submit. Thank you.
Thank you, Honourable CS. Professor Jenda, do you have any supplementary question? You have an opportunity to ask it too, but if you don't have, you are satisfied? Good enough.
Honourable Speaker, I think given the response to the questions that are satisfactory, well, I'm satisfied with the responses. The only follow-up question, Mr. Speaker, sir, would be for the CS to explain to the House the intended processes that underline the implementation of the Social Health Insurance Act, and whether the frameworks, everything has been put into place to ensure that the repeal of the NHIF Act 1998 will not affect Kenyan population. Let me put it that way. Will not affect those who were beneficiaries of the framework of the processes under that.
Honourable CS, you can answer that one.
Thank you, Speaker and honourable members. Yes, indeed, the ministry has a process for implementing the Social Health Insurance Act. And for us, the ministry did gazette a transitional committee that has experts to ensure seamless transition from NHIF to Social Health Authority. The committee has been sitting for the last 3 months. It has developed a roadmap on what needs to be done in terms of implementation. Additionally, the ministry worked on regulations for operationalizing the Social Health Insurance Act. And indeed, the regulations were already approved and gazetted. So we are in the process of finalizing with the transitional committee to ensure that all matters are taken care of. And I want to assure the House that one thing that the transitional committee is ensuring is that the Kenyan should not actually notice that there has been a change from NHIF to social health them after every 2 weeks, so that I get appraise of the process. And our intention and our
not touching on the strike, so that I will give the CS opportunity to represent the Senate and the country. So if you have a different angle, then I can give Senator Mumamuyeka.
Is related to the repeal of the NHIF Act. You have explained the good intentions and the plans you have in place to have a smooth transition to the new system. I wanted to ask whether you are aware that many Kenyans are still paying NHIF but not receiving services. We have many Kenyans whose NHIF cards are not being honored in many hospitals and they are actually stranded. Are you aware of that, and what are you doing about that?
Honourable CS.
Thank you, Honorable Speaker, and Senator of Exchequer release to NHIF. But I want to confirm that NHIF and together with the ministry, we have been having engagements with most of the facilities, which are around the faith-based facilities. We've had a meeting with them. The rural health providers, we have had a meeting with them. The private providers, we have had a meeting with them, and given a commitment that they should continue to provide services because the claims will be honored. Speaker and honorable members, I would like to inform the House that it is really natural that most of the facilities, due to the transition, then they would be a little bit not sure whether their claims are going to be paid or not. And some are taking that drastic action of not providing services. But as a ministry, we are continuing to engage them. And as I said earlier, one of the things that the Transitional Committee is doing is to verify the claims, to verify the assets and liabilities of NHIF. So, Speaker and honorable members, I want to assure facilities that there is no cause of alarm. They do not need to disrupt facilities. That once they have provided services, their claims have been verified and reconciled, they are going to be paid once resources are available. I submit, Speaker and honorable members.
Thank you. Senator Tutu Mohamed.
Thank you very much. Mine is not something like a question, but I wanted to express my gratitude towards the CS, and I want to take this opportunity to thank the CS and the team, specifically the Director General, on this year. The organization intends.
Senator Tutu, what is your question?
Yeah,
I can hear you are leading a statement. Appreciate the ministry.
Yes, I'm trying to.
What is your question?
I want the people of Kenya.
In their notice, we did have a meeting as a ministry with the union to forestall the strike. However, what we agreed on, the union did not feel like it was adequate, and they proceeded and commenced on the strike on the 13th of March 2024. Following that notice, the Kenyatta National Hospital moved to court seeking stay orders against the industrial action to prevent interruption of services in health facilities, an interruption which would endanger the lives, safety, and health of Kenyans. The Employment and Labor Relations Court on the 15th of March 2024 ordered that a whole-of-nation approach be instituted towards resolving the instant long-running dispute in Kenya's health sector and for the purpose of achieving a sustainable solution. The ongoing negotiation and conciliation to incorporate the head of public service, the Cabinet Secretary for National Treasury, the Cabinet Secretary for Public Service, the Cabinet Secretary for Labor and Social Protection, the Salaries and Remuneration Commission, the Public Service Commission, the Council of Governors, each of the 47 county governors, the Kenya Federation of Employers, and the Central Organization of Trade Unionists, and all National Referral Hospital, and all the parties to the suit, and the negotiation and conciliations to seek to comprehensively address all grievances leading to the strike. As part of its mandate, the Whole of Nation Committee has reviewed all the 19 issues raised in the Notice of Industrial Action and classified them into priority areas. 6 of the issues that were raised were classified to relate to the national government, while 9 of the issues were classified to relate to the county government. 4 issues fell under concurrent mandates of both the 2 levels of government. Equally, as that process was going on, the Kenya Union of Clinical Officers on 25th of March 2024 issued a strike notice citing 10 demands. The ministry went ahead to have a meeting with the Union of Clinical Officers with the intention to forestall the strike. And of the 10 demands from the Union of Clinical Officers, they narrowed down to 2 main demands. And that is failure of both levels of government to obey a court order that directed the government to finalize a CBA with KUKO and register the CBA in court. The second main demand was failure to enhance the risk allowance paid to clinical officers. The union wants the risk allowance to be increased from the current 3,000 to 15,000 shillings per month. And this will apply to all the clinical officers within the country. I would like to clarify that of the 14,000 clinical officers in the country, only 158 are in the purview of the national government. In the same breath, on the 26th March 2024, the Kenya Union of Medical Laboratory Officers issued a strike notice citing failure by the government to formulate and sign a recognition agreement with the union. The second issue is failure by government to confirm to permanent and pensionable all UHC staff, COVID-19 employees, UHC interns, and National TB and Disease and Lung Disease Program Fund employees. The other demands that were raised were all discussed by the Minister of Health in a meeting with them. Honorable Speaker and honorable members, the industrial action has had significant impact on healthcare services. This has resulted in unavailability and delayed in health services delivery amongst the Kenyans. It has compromised the quality of care and equally disrupted the referral system. This impact has the potential to contribute to catastrophic health expenditures and adverse health outcomes for the population. Ultimately, the country stands to lose gains made in key health indicators, including maternal health, HIV, TB, malaria, and NCDs. From our checks, referral facilities, specialized outpatient services are significantly affected at 33% and 25% reduction in specialist and outpatient services. So what has the ministry done in terms of the crisis that is here? I want to confirm that the ministry has categorized this into 3 issues: short-term measures, which we are already working on it, medium-term measures, and long-term measures. In the short-term measures, the ministry has already posted interns in lines with the SRC advisory. 1,270 diploma clinical officer interns have already been posted, and they have reported in their areas of posting. Posting letters for 1,210 medical officers, pharmacists, and dental officer interns have been sent to the respective interns, and their names have been published in the newspaper to inform them of their places of posting, and it is expected that then they start reporting from the 15th of March, which is 2 days ago. The next cadre of interns, that is the nursing officer degree and clinical officer degree, their posting letters are ready, and as we speak, a number have started picking them. The ministry has also requested for 267 million for payment of postgraduate registrars' fees arrears, which was an issue raised by the KMPDU and falls under the purview of the national government. I want to confirm that the ministry has received confirmation from National Treasury of release of 200 million towards payment of the postgraduate registrar fee arrears. The ministry has also requested SRC to advise on the demand by the Clinical Officers Union to have the risk allowance increase. We understand that this is going to have an impact on the overall budget, and that is why we have requested SRC to give guidelines. Once SRC gives the guidelines, then the ministry will be in a position to work towards implementation. The ministry has also requested Public Service Commission to review the clinical officers' career progression guidelines so that this can be communicated to them. On the medical laboratory officers, the ministry has already written to the medical laboratory officers informing them of the criteria required for them to be recognized as a union. So we expect that once the medical laboratory officers have met the requirements of a union, then the ministry will go ahead to work towards the recognition agreement that they are pursuing. Under the midterm measures, the Ministry of Health is reviewing the internship policy to address aspects of the program, including the need to transit to internship without any delay. As it is now what we are experiencing, the interns who have been out, some have been out for more than a year. And this actually delays them from getting the license that they need to practice. So the ministry is working on a policy, and yesterday we finalized internal stakeholders validation. Next week we shall be finalizing on external stakeholder validation, and is to invite the Senate that this is a place that we think that we can benefit from the wisdom of the members during the external stakeholder validation. The ministry is also ready to negotiate on the CBA, that is the new CBA, because the CBA under KMPDU, it lapsed in 2021. But we are aware that from the Ministry of Labor is that once a CBA lapses, until a new one is signed, that is when it comes into effect. On long-term measures, Speaker and honorable members, the ministry is in the process of developing the human resource for health policy to address all aspects of human resource for health in the country. the entire spectrum of the value chain from production, supply, internship, regulation, employment, retention and distribution of stock density, skill mix and motivation, productivity and general management. The ministry is also in the process of fully operationalizing the Kenya Health Human Resource Advisory Council to enable it execute its mandate. This entails providing the necessary budget, finalization of HR instruments in order to obtain the necessary skills and capacities to execute its mandate. The other measures, Speaker and Honorable Members, is that the conciliation meetings are ongoing as well as the whole of nation ordered by the court. The court case is actually up for mention today, and the parties are expected to present the progress on conciliation committee meetings and warner. The court is also expected to determine whether the doctor's strike is protected or not protected. I would like to ask of the members of this House that the ministry is doing its level best to ensure that the HRH matters are handled permanently. So we seek your support. And one of the sticky issues is this internship issue. And this internship issue, Speaker and Honorable Members, stems from the reason that we now have very many interns. Previously, we only had one university that was training doctors, University of Nairobi. At the moment, the country has 8 universities that is training doctors. Each year, currently we have over 1,000 graduates from the universities. The internship centers have not increased. We remain with the same number. The specialists have not increased in tandem. We remain with the same number. Therefore, the ministry is working on ensuring how do we manage this process from the time that one enters into university. How do we manage it so that by the time they are coming out for internship, the ministry is ready for them. They go through internship. But the biggest question, Speaker and Honorable Members, would be how do we ensure as a country that we actually provide employment to these doctors once they finish the internship? What stands between us and that is availability of resources. Speaker and Honorable Members, I submit.
Honorable Senators, we're now going to allow you to put questions to the CS regarding the statement or any other questions. In terms of time management, we have 45 minutes. And I see we have almost 12 or 13 members who want to ask a question. Now, in order of asking the questions, there is a request that we first allow members who have not asked any questions this morning, and then we allow the members who've asked. So we're going to proceed that way. Please, Honorable Senators, keep your questions very short. And CS, please, I will also urge you to keep your answers short and precise, so that we can manage the time and we'll be able to finish in good time. First question is going to go to Senator Agnes Kavindu.
Thank you, Mr. Speaker. My question starts from where we stopped before the statement from the CS, and I first of all want to congratulate her. She's standing firm on her job as a woman. I congratulate you as a woman. Thank you. As a woman and a CS, of course. Yes, a woman CS. My question goes to Madam CS about Bishop Kioko Hospital in Machakos. This bishop called me 3 years ago complaining to me that they've not been, their monies has not been remitted from NHIF. And Madam CS, this is a question that is worrying so many of these hospitals. because they don't know the fate after the other organization takes over NHIF. And Madam CS, I know that you have told us that there's money which has been released already, but if you can give us timeline so that even as we talk to them, we can assure them these are the timelines you're going to get your monies. My governor also has really been complaining about remittance from NHIF in the hospitals in Machakos, and this goes across the whole country. So if Madam CS, you can give us timelines, and what else we can beg you to do, Madam CS, is to see as a mother, as a CS, as a mother, how to end up this strike of the doctors, because we are losing so many people. We are losing a lot of people in this country because of the strike. So if also in the negotiations, I'm sure you have reached somewhere. Can you tell us something about, you know, the timelines of these doctors going back to work and starting work as usual? Thank you.
Thank you. Senator Samson Cherargei.
Mr. Speaker, sir. Mr. Speaker, just on a follow-up on presentation of...
Order, senators. I have a list of the senators who've asked the question.
Mr.
Cherargei hayuko hapa. So please allow us to proceed.
Mr. Speaker, allow me to proceed. Mr. Speaker, I would like to just follow up question on the doctor's strike. Madam CS, since you said the government was ready to hire 1,500 medical interns, how many have reported? And what are the terms of engagement with these interns? Because we are being told they wanted 200,000, you are ready to give 70,000 stipend. What are the terms apart from the stipend that you are giving Madam CS? And how many people are on a strike? Is it medical doctors only? Is it morticians? Is it anesthetists? Is it nurses? How many groups are on strike, as we know? Because when it started through you, Mr. Speaker, sir, Madam CS, it started only as a doctor strike over internship program. And on the basis that there was an issue, and update the House, Madam CS, on the issue of collective bargaining agreement between medical doctors and other cadres that we have discussed before. Mr. Speaker, I thank you.
Thank you. The third question will be asked by Shakila Abdallah.
Thank you, Mr. Speaker. I'll be very brief. My question to the CS is, what will be the fate of NHIF staff after the disbursement of NHIF? She is saying they'll be newly employed. Will they be paid their dues for the years they have been working? Because that part is silent from the government. Thank you, Mr. Speaker.
Madam CS, you can answer the three questions.
Thank you, Honorable Speaker and honorable members. The question by Senator Kavindu regarding Bishop Kioko, I think it's what I have responded to previously, and this is now the faith-based facility, and that the resources that we are receiving, as I did say, we have received a letter from Treasury confirming that we are going to receive the monies. So we await to receive the money, and we expect that they will hit our account this week. The National Hospital Insurance Fund is already working to ensure that once we receive the money this week, then from next week, payments should start going out to those claims that have been verified. And regarding the strike, and for me to give a definite date as to when the doctors will go back to work. Honorable Speaker and honorable members, I would like to say that we are now in process of a negotiation. And with a negotiation, I am not able to confirm with certainty that then by tomorrow they'll be back to work. Of course, I would like that we finish in the shortest time possible. In fact, I would like that, even since the matter is coming up for mention today by the Employment and Labor Relations Court, if out of it then doctors are able to go back to work today, that would be the ideal situation for us as a country. But we are going to put our best foot forward in this negotiation so that we ensure that then we go back to operations soon as possible. On the question raised by Senator Cherargei, I would like to confirm, first of all, that the medical officers, who in turn medical officers are not 1,500, but they are 1,210. This includes medical officers, pharmacists, and dentists. But after they went on strike, other cadres joined them. That is the clinical officers who joined the strike, and also the medical laboratory officers who joined the strike. So as we speak today, we have the medical officers on strike, we have the clinical officers on strike, and we have the laboratory officers on strike. But I would also want to confirm that we have those doctors who have been patriotic enough and they have continued to provide services. They are manning the emergency services, they are manning some of the facilities, and we are ensuring continuity of service. We have put in place administrative measures to ensure that at least services are being provided in the health facilities. The issue at hand is the offer that we have given, and I want to confirm that the ministry, having been constrained by National Treasury, that we post interns based on the available resources. The ministry did write to SRC for guidelines. And the guidelines we received from SRC is that the interns ought to get a stipend and not a remuneration. So the stipend that was offered is 70,000 shillings. And that is what we have offered. As I did indicate, the letters have gone out for medical officers, and we are going to begin taking stock from tomorrow in terms of those who have reported. But I also want to confirm that 1,270 clinical officers have reported in their duty stations. And also to confirm that it was not just the stipend for doctors that was fixed. Equally, the stipend for clinical officers was fixed. In the previous, the clinical officers were earning 15,000 shillings as a stipend for internship. Under the new regulations and guidelines that have been given by SRC, that has been enhanced to 35,000. And I want to confirm that those clinical officers have reported. What we are waiting, and the letters are out now, nursing officers degree and clinical officers degree have started collecting their letters, and the stipend is 50,000 shillings. In terms of payment to the doctors, Speaker and honorable members, the conversation of healthcare financing has to be discussed, not just by the Ministry of Health, but the whole government. And I believe that is the wisdom that the Honorable Judge of the Employment and Labor Relations Court ordered, that a whole of nation approach is taken so that we discuss. But as a ministry, we have not sat back. That is why we did bring to this Honorable House the 4 acts. And from the 4 acts, we have the Social Health Insurance Act, which in itself is supposed to enable us to collect resources and use those resources for providing healthcare services. One of the items that is going to be recovered by the resources from the Social Health Act is payment for all human resource for health officers across all cadres. And I really want to thank the nurses who have continued to work, to thank the doctors who have continued to work, and to thank all the cadres who have continued to provide services amid this crisis. Speaker and honorable members, I submit.
Thank you, CS. Next question will come from Alexander Mundingi.
Asante, Bwana Spika. Swali langu ni kwa waziri wa afya. Kwanza, waziri wa afya, ni asante sana. Mimi ni mmoja wale wanaume wanasupporti CS ama governors wakina mama wale wanafanya kazi nzuri. Pongezi kwa sababu wizara ya afya iko na shinda, kwa sababu tunajua katika Kenya iko katika devolved katika county government, na tunajua county nyingi siko na mambo ya ndeni na mambo ya pending bill, na umejaribu sana kulainisha afya. Swali langu ni kukuuliza, kwa sababu tunajua iko katika county government, na ninastuka sana kuwa MP wale wanafaa watupatie pesa ya kupatia county government, ambaye wewe uweze kupatia county government pesa ipitie hapa, ndio anastumu wewe kusema uende nyumbani. Yangu ndio tufike hapo kwa nawasiri juu ya ndero. Wewe nyamaza.
Order.
Kwanja county yako iko na 90 billion. Nyamaza. Kwanza niulize swali. Ni Senator wa Embu County anaongea.
Order, Senator Alexander, order. What's your point of order, Sifuna?
Mr. Speaker, this is actually very embarrassing for this House. Standing orders require that you put a question to the CS. We are not here to worship the CS. We are not here to worship the CS. Ask a question. You cannot give us stories. If you want to give us stories, go and see the CS in the ministry and give us those stories you are giving us here. Mr. Speaker, please.
Let's hear the Senator. Order. Order, senators.
Mr. Speaker,
order. He's on a point of order.
Yes,
Let
I'm
us
on a
hear
point
him.
of order. Mr. Speaker, we have very few minutes, and this is a critical national discussion and national debate. We are not here to kiss people's behinds. We are here to ask critical questions about the doctor strike. Can you limit the contribution of the senator to a question, Mr. Speaker?
Thank you. So, Senator Cherargei, what's your point of order?
Sorry, can I use this? Mr. Speaker, sir, I'm standing under Standing Order 121 and 122. If you have noticed, Mr. Speaker, today since morning, the Nairobi Senator has had a habit of shouting and demeaning members. Mr. Speaker, I would like to request your attention, kindly. Mr. Speaker, have you noticed since morning, the Nairobi Senator has been shouting, belittling, and hurling insults at the members across the aisle, especially on this side, Mr. Speaker. You need to rein. It is becoming grossly misconduct. He should be thrown out, Mr. Speaker. Because, Mr. Speaker, under the Constitution freedom of speech, Senator Dr. Ali Munyi Mundigi has a right to ask the question they want. Why would you allow Senator Sifuna to use unparliamentary language by calling us that we are kissing people's behind? We are not. Our kisses are for somewhere else, Mr. Speaker. We don't kiss anybody's behind, Mr. Speaker. We just say it as it is. He must withdraw the last statement of using unparliamentary order members. Just wait. Mr. Speaker, he must withdraw the unparliamentary language of telling us that we are kissing other people's behind. We know what kisses are meant and where to kiss. We cannot be told by Senator Sifuna, Mr. Speaker. Can you call him out of order?
Honorable Senators. Honorable Senators, order, Cherargei, order. Senator Sifuna stood on a point of order that Mundigi was wasting time with a long statement instead of asking a question. And I have to warn Senator Mundigi. I did make a ruling and I was very clear. When you're given an opportunity to ask a question, go straight to your question and make it short and precise. Senator Sifuna, can you stop directing the chair? I don't need your assistance. Exactly, you are shouting across the aisle. Two wrongs don't make a right. Senator Sifuna, I would urge you to withdraw kissing whatever part of the body you had referred to and make it more parliamentary and withdraw that statement.
Luckily for me, I have the full range of the English language. I will withdraw the statement of kissing someone's behind, which is exactly what is happening, and replace it. I have withdrawn it. I am withdrawing it. Why? Mr. Speaker, can I continue?
Order. Proceed, Sifuna.
Mr. Speaker, if they don't listen to me, how will they hear it when I'm withdrawing it?
Proceed.
How will they hear when I'm withdrawing?
Order, senators. Order. We cannot proceed like this, senators. Order.
How else am I supposed to withdraw?
Just
How
withdraw.
many ways are there to withdraw other than the way that I am withdrawing?
Withdraw the
Mr.
statement.
Speaker, I am going to replace the phrase kissing the behind of this, the CS, which is exactly what they are doing, and replace it.
Can I hear him? Wait, let's hear him.
Replace it with massaging the CS for health, Mr. Speaker, because that's what they are doing.
Okay. Senators. Senators, I have Oroba. Gloria. Order, senators. We cannot, no, I'm not going to give any more points of orders because we are not listening to each other. Order, senators. He withdrew, Cherargei. He withdrew. Order, senators. Senators, order. Order, senators. Cherargei, I will start by throwing you out. Order. I was listening. You were not listening. Senator, I will throw you out. We are not listening to each other, senators. Cherargei, you were not listening to Sifuna when he said he is withdrawn that statement. He has the right to replace it. It needs to make a sense. Order, the ruling. Order. Senators, you want us to proceed, senators? I'm not engaging you, Cherargei, in an exchange. I asked him to withdraw, and he withdrew. So can we proceed, senators? Let us proceed. The matter was parliamentary language. The issue was parliamentary language. Gloria, what is your point of order? But senators,
Mr.
I will
Speaker,
not...
Mr.
One
Speaker.
moment, Gloria. One moment. I will not allow a point of order if we're not going to engage ourselves in proper manners, okay? Let us agree. If you have a point of order, press your intervention button and I'll give you an opportunity. But shouting at each other across the aisle and shouting at the chair will not be entertained. Gloria, what is your point of order?
Mr. Speaker, under Standing Order 122B, Mr. Speaker, and let me read it, gross disorderly conduct 122B, declines to retract use of unparliamentary language or declines to offer apologies despite having been ordered to do so by the Speaker. Mr. Speaker, for me today, and the reason I want to bring this to your attention, Mr. Speaker, we have had cabinet secretaries coming even today, and I have not had this language being referenced to our Minister of Defense. But Mr. Speaker, when a woman comes here, we have Nairobi Senator starting to throw words and demean women leaders. Because, Mr. Speaker, what Senator Sifuna is doing is belittling the women in this house and our women leaders. He must withdraw and apologize profusely, because when you see women, you cannot just be thinking about sexual references, such as kissing people's behinds, Mr. Speaker. This is completely out of order. And Senator Sifuna must not only apologize to this house, but to the women of Nairobi and to the women of Kenya. We are tired. Apologize and withdraw.
No, senators, I want to put this matter to rest so that we can continue to ask the question. Senators, order. As the chair, I asked Senator Sifuna to withdraw the statement he made about whatever he said, about kissing the behind. And Senator Sifuna did exactly that. He withdrew. He retracted that statement, and he retracted it. Just a moment, Cherargei. You know, we cannot continue like this, seriously. Senator Sifuna retracted that statement to my satisfaction as the chair. Okay? Now, if you're going to make another point of order, which is not touching on parliamentary language that Sifuna used, I would have listened to you. But we are going about the same issue that that was raised and was withdrawn. So, senators, we put this matter to rest, and we go to the next question. Senator Cheriot. There is nobody. Order. Mundingi. Mundingi. Senator Mundingi, if you had used the opportunity I gave you to ask the question, you would have asked by it. Now you've been overtaken. Senator Now it seems, Senator Professor Margaret Kamar.
Thank you, Mr. Speaker, for giving me the opportunity. May I take the first opportunity to thank the... Mr. Speaker, can you...
Sifuna, can we hear the professor in silent? You're protected, Senator. Go ahead.
Thank you, Mr. Speaker. I want to thank the Minister for a good response, and I want to thank her for talking to the country and bringing some comfort, because we have all been very concerned about what's going on. Mr. Speaker, could the Minister assure us and the country that the current negotiations will not stop again? Because we reach a point when the medical doctors, the striking doctors as we call them, reach a point when they were saying it is the government that is on strike, it's not us that are on strike. There was a point also that we witnessed the negotiating side of the government walking out. Because negotiations are negotiations. So long as the unions are here, negotiations must take place. Can we get an assurance that there will be no walking out until this is done from the minister? Secondly, the issue of risk allowance, Mr. Speaker, is something that has been on for many years. Why is it taking very long, and yet CRC was part of the Whole of Nation Approach Committee? Why wouldn't it have been discussed alongside that so that we don't have this delay? The problem, Mr. Speaker, is that people have died. And I think the minister knows that people have died. People are suffering as we are talking. People have had to go for very expensive alternatives. Why would we be dilly-dallying with an issue called risk allowance, which was done in the 90s? It was not even in the year 2000, it was before, when this idea of risk allowance, which was going on in other countries other than Kenya, were negotiated. Why would it not be done? So, finally...
Senator, just...
Two.
You've asked two questions.
Thank
That's
you.
more than enough. Senator Veronica Nduati.
Thank you, Mr. Speaker. And you have put to rest the points of order. Otherwise, I would have maybe advised my colleague, Senator Sifuna, on the meaning of common parlance of English language and how you cannot retract and then reinstate the statement in different words. Mr. Speaker, I will now go straight to the questions. I will go straight to the question to the Honorable CS. Once again, welcome to Senate. And as you very well know, healthcare remains a critical pillar to the welfare of our nation, and ideally, it should enjoy budgetary priority in resource allocation. So, Honorable Cabinet Secretary, Kenyans are very concerned about how prepared the ministry is in managing the transition from NHIF to SHIF without exposing and while avoiding any gaps that may expose the Kenyan population who require health care on a daily basis. And question number 2, so how prepared is the ministry in managing that transition? Number 2, you know, it is women who give birth. Linda Mama program seemed to have enjoyed a lot of popularity and is a program that was acclaimed and approved. Within the SHIF framework, the new framework, what is the ministry doing to design a specific program to Linda Mama, specifically that woman who is pregnant, for prenatal, labor and childbirth, and postnatal care without limiting those visits to 2 or 4, but to Linda Mama in as much as they require that postnatal care until the mother and the baby are both safe in the ministry and within the public hospitals that we have in Kenya.
The third question will be asked by Senator Hamida Kibwana.
Thank you, Mr. Speaker. Madam CS, I've just been wondering, actually the morgues are full now. The patients are not being attended to. They're not attending to the patients and they are dying. Does the government realize that this is a matter of life and death? How long will this go on, seriously? So we should continue losing lives just for the government to have its own time to honor the CBA? I think, seriously, it pains. It really hurts. Number 2, we've also realized that maybe once the interns are back, the interns are sent to work in facilities unsupervised. Now, this is, of course, risky, without any personal, whatever, professionals being around. I'm wondering, we are talking about deaths, we're talking about interns also who are unsupervised. I don't know how this issue is going to be tackled, but please, our people are dying, Madam CS. Kindly do something. Thank you.
CS.
Thank you, Honorable Speaker and honorable members. I'll begin from the question of Senator Professor Kamar, that the KMPDU has alluded to the government being on strike. And they have explained that this is because the CBA was not implemented from 2017 to date. Honorable Speaker and honorable members, the CBA that was signed had several aspects. And in my earlier submission, we have put those matters into the different areas that need to take responsibility. We have matters for the national government, we have matters that are cross-cutting, we have matters of county government. Speaker and honorable members, I want to confirm that of the 6 issues that pertain to the national government, we have addressed them. The issue of postgraduate fee arrears, that has been addressed with the release of 200 million from National Treasury for payment. The issue of basic salary arrears within the CBA. As for the doctors who work within the national government, that aspect has been met. And in fact, there is an overpayment. And now the government is asking, what do we do with the overpayment of the arrears to the doctors? The issue of CBA between KMPDU and Kenyatta National Hospital, was waiting concurrence from Salary and Remuneration Commission. That has already been done. The issue of CBA between Moi Teaching Referral Hospital and KMPDU, that has already been finalized. It was a matter in court and a decision was already passed. The issue of CBA between Kenyatta University Teaching and Research Hospital and KMPDU, the CBA is now ready. Kenyatta University Teaching and Referral Hospital has called the unions to go and discuss and negotiate on the CBA. So, Honorable Speaker and Honorable Members, on matters pertaining to the national government, progress has been made. The only sticky issue is the stipend. And Honorable Speaker and Honorable Members, I want to ask of this House that as for that stipend, we are asking that if the interns, and should they accept that, then they open room for negotiation that government has offered. They have not come to the table to tell us that, no, we will not take that, we want this. That must be allowed to happen. Professor Kamar, on the issue of government walking out during the discussion, I was in that meeting, and I want to confirm that the government did not walk out. The meeting adjourned. Why did the meeting adjourn? Because we were following the orders of the judge from the court. And the judge ordered that the doctors should suspend the strike for negotiations to proceed. And that is what we were asking of the doctors. Suspend the strike, negotiations to proceed. And I want to confirm to the House that negotiations will be good. Negotiations will be done, in fact, accelerated if we have no people dying out of this strike. They will be accelerated if the doctors are at the bedside of the patients. The risk allowance, I want to clarify, on the issues raised by KMPDU, risk allowance does not arise. The people who raise the issue on risk allowance is the clinical officers. And they're saying they want the risk allowance to be enhanced from 3,000 shillings per month to 15,000 shillings per month. Honorable Speaker and Honorable Members, that is 500% increase in the risk allowance. That is an issue of budget. Once we get SRC guidelines, if that is possible, then we put it in the budget for consideration. And once the House, the National Assembly approves our budget, Exchequer is released, we shall be able to meet that. Because we know that whatever they are doing is risky, and indeed, they deserve risk allowance. So the issue is the movement from 3,000, 15,000, the 500% increase. If SRC confirms that that is in order, then we'll put measures in place for resources to be put together for that. The issue raised by Honorable Senator Veronica. Earlier, I have spoken about the transition from NHIF to Social Health Authority. As a ministry, we have done our best. And that is why we put together a transitional committee, a committee of experts to guide the process. And as I did reported earlier, there is a roadmap, and we meet after every 2 weeks, and we are satisfied with the progress that is going to be a smooth transition, and no patient should actually notice that there was a change. It should be a seamless transition. On the issue of Linda Mama, I want to confirm, as a mother myself, and probably aspiring to get another child, maternal health is of importance to me. So I will not be the one to preside over a situation where maternal health is not covered by this country. And I want to confirm that in the Social Health Authority, reproductive health has been covered under the benefit package. In fact, it is an expanded package from what was there under Linda Mama. So let's not be stuck on the name of Linda Mama. Let us be concerned about what is it that they were getting then and what is it that they are getting in the new one. And I confirm that is expanded and the benefits are expanded. On the question raised by Senator Hamida regarding the government and the ministry, whether we know the situation. Yes, Senator, we indeed know the situation. On a daily basis, we are tracking what the situation looks like. We have developed a tool that is being filled by the county governments. We have developed a tool that is being filled by the national referral hospitals, whom we have 100% control over. And for the weeks that the strike has progressed, I want to confirm that in our teaching and referral hospitals, Moi Teaching and Referral Hospitals has recorded the highest increase in the number of medical officers who have gone back to work based on the administrative measures that we have put in place. But also take responsibility that in Kenyatta, we have an issue because the registrars have not gone back to work. And registrars are people who are now doing their postgraduate training. We have government-sponsored and private-sponsored. Those are the people that we are talking to so that they can get back to work and be able to carry on with what they have been doing. So we do understand as a ministry the gravity of this matter. And that is why on a daily basis, nowadays, for the last 3 days, I think, we have been in meetings till midnight to find a solution to this issue. And as I have said, this solution will not just come from the Ministry of Health. It will come from the whole of nation approach and the ministry being able to implement what will have been agreed on. I have also said that we expect a ruling from the court today. The mention is happening today. But the judge in his wisdom already ordered the doctors to suspend the strike. I want to plead with the doctors that if they respect the court orders and suspend the strike, they will create a very good environment of being listened to, and even the government also moving forward so that we meet somewhere with the doctors. Regarding internship centers, I want to confirm that as a ministry, we have a criteria that is used to determine what centers become internship centers. There must be existence of specialists who will supervise the interns. There must be existence of equipment that the interns will use. There must be existence of commodities for the interns to use. And that's why we are saying we want to take time and ensure that this matter is resolved for once. Because we have 85 internship centers in the country. 65 of them are in public hospitals. So as a ministry, we have at least ensured that the commodity aspect is taken care of. The equipment aspect, we are working on it. And now, what was remaining is to ensure that there are specialists there, but to confirm that we have a number that should be able to supervise the internship. Speaker and honorable members, I would like to say as well that this is a shared function devolved. So the county governments have their responsibility to take, the governors to take in this matter. Where the union has raised specific issues with them, we expect that the governors should handle those issues. The issues that have been raised to the national government, I have confirmed to this House that indeed we have handled them. Speaker and honorable members, I submit. Thank you.
Thank you, CS. Senator George Mbugwa. And please be very brief.
Okay, thank you, Honorable Speaker. Madam CS, I have a simple question to you. From where you sit, due to the importance and the complex nature of this sector, do you think it's time the country start a conversation of transferring the human resource of health from the county government and the creation of a health service commission so that we can have order in this sector? Thank you.
Senator Beatrice Ogola.
Thank you, Mr. Speaker, sir. My question, the first one is, Madam CS, what is the fate of the UHC staff whose contract ended, taking into consideration that as a nation we are looking at achieving universal health? On the strike, Mr. Speaker, sir, I want to say that negotiations need goodwill from both parties. Even the language we use when we are negotiating is very important. I realized the CS at some point was giving a statement that was kind of running away from the whole challenge. Like when you say only this number belong to the national government, it is like saying somebody else should be solving it. But the buck stops with you, and the buck stops with the head of state. I do not understand why as a nation it is so easy to give foreigners or other people good packages. I remember sometimes back when we were engaging the Cuban doctors,
Senator,
a lot was given to them.
Get to your question, please.
Why is it difficult to attend to the doctors' need when we could give the Cuban doctors a lot of leeway?
Thank you, Senator.
You also said,
Senator, you
that
can only ask
they have
one
not
question.
come to us.
Senator Beatrice.
Yes, Speaker.
You've asked two questions. Senator Beatrice. Thank you, Senator. Senator Mofire.
Thank you, Honorable Speaker. My question is on Marimanti Level 4 Hospital, which is in Tharaka-Nithi County. This is the only facility in the entire eastern part of Tharaka-Nithi County, which serves quite a number of catchments, including Ukambani, part of Ukambani. This hospital, Madam CS, lacks some very essential machines, including the CT scan, the renal unit equipment, and the mammogram. Honorable Madam CS, what is the ministry doing to make sure that this facility is equipped so that we can get people having services that are required, considering that this is the only facility? Currently, we are about to graduate, this facility is about to graduate into a level 5 hospital, and quite a number of nurses are taking rotational courses there. What is your ministry doing to make sure that the Marimanti Hospital is being equipped with the necessary machines as required?
Thank you, Senator. CS, please respond.
Thank you, Honorable Speaker and Honorable Members. The question raised by Senator Mbugua, whether it is a high time for there to be a health commission. Honorable Speaker and Honorable Members, I take note that this is the House that is the defender of devolution. This is the House that is supposed to ring-fence and take care of devolved function. Having a health commission would be ideal, but that process would be outside the mandate of the Ministry of Health. It would be a constitutional question. So since the conversation is ongoing, and if everyone believes that then that is the direction to be taken, then we as a ministry are happy that then the process of having a health commission through a constitutional process is then started, so that then that is achieved. On the issues raised by Senator Beatrice, I do understand your concern regarding the language of discussion. I take responsibility if I have sounded like I am not using the right language, but at times it becomes difficult when you want to give the real numbers, which, for example, when we speak about clinical officers, of the 14,000 clinical officers in service, 158 belong to the national government, and that is under my armpit. So that is to say that then the conversation needs to go beyond the Ministry of Health and go to the governors, so that then they are able to take care of the remainder balance of the clinical officers. Regarding the Cuban doctors, I would like to confirm, Honorable Speaker and Honorable Members, that when we came into the office, we looked at the contract that was there. And for sure, it was not competitive enough. It was not sustainable for the government to continue with that program. And we did terminate the program of Cuban doctors, and they went back to Cuba.
CS, I'll just interrupt you. It's already 1 o'clock. I will give you 1 minute to answer the question for more fire, so that we can rise as a House.
Thank you very much, Speaker and Honorable Members. On the question by Senator Gataya, I would like to confirm, Senator, that I have personally been to Marimanti Level 4 Hospital, and we were there to look at what are the needs, because we had received a request from the governor regarding elevation of that facility. And we did agree that we do not want just to elevate and call it Level 5 for a name. We have to ensure that it has the equipment, it has the HRH, and it has all other items that are required for its lifting. So we are in discussion with the county government to see how we support it to get the much needed equipment, so that once then it meets the criteria, it can be moved to Level 5. Speaker and Honorable Members, I submit. Thank you very much.
Thank you, Cabinet Secretary, Ministry of Health, for appearing today. Honorable Senators, it is now 1:01 p.m. and having concluded the business for which I extend the hours of sitting pursuant to Standing Order 34-2A, the Senate stands adjourned until today, Wednesday, 17th April 2024 at 2:30 p.m.
Ili kupata uchungu mtamu kama skiza tune yako, bonyeza *812 *504#.
Je, wajua
Speaker and the honorable members, on the issue of Edu Afia, I want to confirm that under the current Social Health Act, the ministry has provided a base cover, and this base cover is comprehensive with a benefit package that covers everyone. We all have to agree that Edu Afia was specific to students. These students come from families. These students have parents, have guardians. So under the Edu Afia, all these people are being covered. That it did not make sense to have one small cover just covering the student. We needed to have the parent, we needed to have the guardian covered. And that is why under the Social Health Authority, the cover is for the whole family. It does not discriminate and say this is for a student, this is for Linda Mama. No, the cover is for Mama, the cover is for the student, the cover is for Baba, the cover is for the whole Jamii. On the third question, which Honorable Sifuna has asked regarding the payment for Nairobi County. Speaker and honorable members, I would like to confirm that as a ministry, it concerns us about all health facilities, public facilities, faith-based facilities, private facilities. All these have to be paid by NHIF. And I want to confirm, Honorable Speaker and honorable members, that NHIF has a process of payment. And the process of payment does not exclude other facilities depending on where it belongs. It is a process that, one, requires that the claim is verified. Whether the claim is from a public facility, a private facility, or a faith-based facility, it has to be verified. Once verified and reconciled, then it goes to payment. So I also want to confirm that, as I had indicated earlier, Honorable Speaker and honorable members, we have had a delay of exchequer. That has given rise to the many huge bills that are being experienced across the country. And I have gone ahead to confirm that indeed we have received confirmation from Treasury that resources are going to be released this week for payment of claims. Honorable Speaker and honorable members, I submit. Thank you.
Senator Mwenye Haji Mohamed.
Asante Mheshimiwa Spika. Langu ni kumuuliza waziri kwamba kuna malumbukizi ya malipo kwa zahanati na vituo vya afya ambayo yameendelea kwa muda mrefu. Na majibu yake Mheshimiwa Spika hayajaridhisha kwa sababu hajasema pesa zinazodaiwa ni ngapi na zitalipwa vipi. Kwa sababu tumeona wakati NHIF ilipokuwa inafanya kazi, malipo yalikuwa haendi. Na sasa tunatoka kwa NHIF tunakwenda kwa shirika jipya. Tunataka ueleze bunge hili ni mipango gani ambayo umepanga, madeni kwanza ni pesa ngapi, na pili una mipango gani ya kulipa madeni hayo, kwa sababu ukisema tu kwamba yatalipwa, hiyo ni mambo ambayo ni alifu ulela Mheshimiwa Spika. Asante.
Senator Oloba Magoma Gloria.
Thank you, Mr. Speaker. My question is with regards to the government program of Linda Mama. I know that Waziri has clarified that there's a cover that takes care of the whole family. However, under Linda Mama, which was a program initiated under NHIF, issues on maternal health care were actually specified. For instance, complications after birth and things like that. This new cover that you're saying is the alternative of Linda Mama, does it still cater for the specific maternal health care issues that were being taken care of under Linda Mama? As well, if you could also clarify, the Kenya Kwanza government
came in we signed a women charter. And under the women charter, we had promised that we will be giving all mothers who have just given birth, that we would give them free sanitary towels, and would also give them 3 months or 6, I'm not quite sure, but I think it's 3 months worth of diapers, free diapers, disposable diapers to their children. This particular issue, which is supposed to be covered as well, I would have thought under Linda Mama, it seems to have disappeared somewhere. Could we get a clarification on that as well? Thank you.
Senator Osotsi, and then she will answer those 3, and then we'll go to the statement direct.
Thank you, Mr. Speaker. Mr. Speaker, mine is in relation to the third part of the question. It talks about accountability by the health facilities. While I appreciate the response by the Cabinet Secretary, we'd like to know the list of the health facilities which have been suspended or terminated under NHIF and the reasons of the same. I'm asking this, Mr. Speaker, because I have been made aware that there could have been some discrimination in this process and some unfair practices. And I have a specific case that has been brought to me by my constituent of a hospital by the name Meswo Medical Services, NHIF code number 00131152, where the audit was done in April 2022, and the results of audit indicated that there was no problem. But only a few months later, this hospital has been suspended from NHI. They may...
Faki, sorry, my apologies. Regarding the payment of claims, I want to confirm that the ministry is seized of the figures. The total money owed to NHIF is 30 billion. And out of this 30 billion, Senator, 22 billion is from government institutions. And that is why I stand here confidently saying that, having had the discussion chaired by His Excellency the President, the Ministry of Treasury, and Ministry of Health, there is a plan for release of resources, which I have confirmed that we are going to receive this week. The PS actually got confirmation yesterday of the 8.5 billion. And this money is going to be put to prudent use of payment of claims. Look at that facility to verify what were the issues under that facility, and we shall be able to provide a response to Honorable Osotsi. I submit, Speaker and Honorable Members. On the issue of pads and diapers, I want to agree, Honorable Speaker and Honorable Members, that as a mother, I want to confirm that those two are very, very important. But as it is now, we do not have resources in the budget for those facilities. Push for them, for provision of them. Should there be resources, I want to agree that those are items that should actually be provided. But I also want to confirm that I know that pads are being provided by the Ministry of Gender. So with the diapers, that is something that we can pick up with the ministry and try and get resources to avail them. I submit, Chair.
Senator Homal Sheikh, you want another clarification because your question you feel was not answered adequately. And the Chairman held, just wait a bit.
Mr. Speaker, my question is...
End date of the Edu Afia. And the reason why there was an end date, it was actually end of a contract. So it is expected that then the Ministry of Education should have made alternative arrangements. I have had a meeting with my colleague Cabinet Secretary for Education, and we said, should they need the service to be covered for those who are still in India, then they need to write to the ministry so that they give an undertaking of payment of the premium, so that then that can be covered. So far, we have not received a letter of extension from the Ministry of Education. We have not received an undertaking.
Senator Veronica?
I would request you give us a guidance as to whether we are getting a chance to still ask the important questions.
Yes, we'll ask. You have no problem with
regarding the question she has been answering.
Yeah, so because also senators want to ask the issue on the strike.
Yes.
We are open that you can still ask on NHIF.
Okay.
So there is no problem.
Most, thank you.
So, Honorable CS.
Thank you, Honorable. We are all aware of the ongoing crisis in the case strike notice of intended industrial action, citing failure of both the national and county governments in implementing the 2017 CB. In there, it was adequate, and they proceeded and commenced on the strike on the 13th of March 2024. Following that notice, the Kenyatta National Hospital moved to court seeking stay orders to injure the lives, safety, and health of Kenyans. The Employment and Labor Relations Court on the 15th of March 2024 ordered that a whole-of-nation approach be instituted towards resolving the instant long-running dispute in Kenya's health sector and for the purpose of achieving a sustainable solution. The ongoing negotiation and conciliation to incorporate the head of public service, the Cabinet Secretary for National Treasury, the Cabinet Secretary for Public Service, the Cabinet Secretary for Labor and Social Protection, the Salaries and Remuneration Commission, to seek to comprehensively address all grievances leading to the strike. As part of the issues that were raised were classified to relate to the national government, while 9 of the issues were classified to relate to the county government. 4 issues fell under concurrent mandates of both the two. The main demand was failure to enhance the risk allowance paid to clinical officers. The union wants the risk allowance to be in 1,000 clinical officers in the country. Only 158 are in the purview of the national government. In the same breath, on the 26th March 2024, the Kenya Union of Medical Laboratory Officers issued a strike notice citing failure by the government to formulate and sign a recognition agreement with the union. The second issue is failure by government to confirm to permanent and pensionable all UHC staff, COVID-19 employees, UHC interns, and National TB and Lung Disease Program Fund employees. The other demands that were raised were all discussed. Impact on healthcare services. This has resulted in unavailability and delayed in help due to catastrophic health expenditures and adverse health outcomes for the population. Ultimately, the country stands to lose gains made in key health indicators, including maternal health, HIV, TB, malaria, and NCDs. From our checks, referral facilities, specialized outpatient services are significantly affected at 33% and 25% reduction in specialist and outpatient services. So what has the ministry done in terms of the crisis that is here? I want to confirm that the ministry has categorized this into 3 issues: short-term measures, which we are already working on it, medium-term measures, and long-term measures. In the short-term measures, the ministry has already posted interns in lines with the SRC advisory, 1,207 posting letters for 1,210 medical officers have been sent to the respective interns, and their names have been published the 15th of March, which is from National Treasury of release of 200 million. So requested SRC to advise on the demand by the Clinical Officers Union to have the risk allowance increase. We understand that this is going to have an impact on the overall budget, and that is why we have requested SRC to give guidelines. Once SRC gives the guidelines, then the ministry will be in a position to work towards implementation. The ministry officers, collaboratory officers have met of health is reviewing the internship policy to address aspects of the program, including the need to transit to internship without any delay. As it is now, what we are experiencing, the interns who have been out, some have been out for more than a year. And this actually delays them from getting the license that they need to practice. So the ministry is working on a policy, and yesterday we finalized internal stakeholders validation. Next week we shall be finalizing on external stakeholder validation, and is to invite the Senate that this is a place that we think that we can benefit from the wisdom of the members during the external stakeholder validation. The ministry is also ready to negotiate on the CBA, that is the new CBA, because the CBA under KMPDU, it lapsed in 2021. But we are aware that from the Ministry of Labor is that once a CBA lapses, until a new one is signed, that is when it comes into effect. On long-term measures, from production, supply, internship, regulation, employment, retention and distribution of stock density, skill mix and motivation, productivity and general management. The ministry is also in the process of to ensure that the HRH matters are handled permanently. So we seek your support. And Speaker and honorable members, stems from the reason that we now have very many interns. Previously, we only had one university that was training doctors, University of Nairobi. At the moment, the country has 8 universities that is training doctors. Each year, currently we have over 1,000 graduates from the universities. The internshalists have not increased in tandem.
Welcome everybody. Welcome back. Happy Saturday. This is going to be quite the stream here. We have some very exciting information for you guys. This is the stream where we determine the winners of the Parallel Dimensions contest. And since a lot of you guys are from out of country and you can only win prizes if you're in the US, I've split it up into two pools. So basically, there's the eligible, contest eligible, top 5 winners, and then for those of you out of country, I'm going to send you guys some of my really nice photography art prints. So even if you're out of country, I got you top 3 winners with some custom art prints signed by me and everything. So I want to make it worth everyone's while. Everyone's going to win here today. What's up, everybody? If you guys can hear me and can see me, give me some thumbs ups, because I'm in a new space. If you can't tell, we just moved into a new spot. I'm still setting up my studio. It is kind of halfway in the works right now, so hopefully you guys can hear me okay and it sounds all right. Yep. I'm excited. I'm very excited for this new spot. It's gonna be a good one. So before I jump in and low volume. Big thumbs. I got big thumbs, but one dude's got low volume. Well, George, turn up your headphones or your speaker, maybe, because we got thumbs ups all around. Awesome. Yeah, my mic is it's a little further away this time, so we're gonna have to bear with me on this one. I think I'm getting good levels. Let me check this. I'm getting halfway decent levels. Maybe I can crank this up a little bit louder for you guys. But I could also just talk louder too, maybe get a little bit closer. So, let me just make sure the autofocus is going. And yeah, I got my camera set up. It's all nice. All right, so where else? What else are we doing? Yeah, Skillshare, that's coming. I got you guys on that. Wonderful. So the next thing I'm going to be talking about, actually the first thing I'm going to be talking about, is how I got from concept art to the final version of my render, which you guys can see right here. So let me see if I can pull up something. I'll show you guys the process, because I learned a whole lot doing this, and I hope you guys did too. So let's see real quick. I want to pull up all the different versions that I rendered out while I was doing this. So as you guys know, on the first stream we started with concept art in volume 1 of the masterclass. We made this in Photoshop, and this is the final. So they're very, very similar. you know, the mountain's a little smaller, but I use this to guide my render here. But I started with this. This was the first thing I started with on the stream number 2, I believe. Volume 2 is where we talked about the ground plane. In the very next stream, the 3rd stream, we talked about the volcano, and we kind of built that out, built out the background a little bit, added some like steam and fog here that I think worked out really well, and we used lightning to build out our lava. In the next stream, we built out the foreground. You know, we added these huts and these stumps and everything. But then this is what you guys didn't see. You know, throughout the week I kept working and added some stuff in the foreground here, changed the lighting a bit, changed the sky, and finally photo scanned myself and got to our final image here. So I want to walk you guys through that process of how I did that. But let me actually show you guys my render too. I want to show you my final render. So here inside of, let's see here. Here we go. Awesome. So I got DaVinci pulled open, and let me just show you guys my render. I have every single submission here. We're gonna go through every single one, and we're gonna review them, and I'm gonna give you guys notes and feedback, and we're gonna whittle it down to the top 3. Well, I guess since we're doing 2 pools, there's gonna be a top 5 US only, and then there's gonna be a top 3 overall. You know, every render is included, and then I'll be sending out you guys some